Write the sentences to describe the work of the specialist in each branch of medicine. Look at B opposite to help you. 1. Dermatology. A dermatology specialist in of disease. 3. Traumatology. A traumatologist specialist training in inflammatory disease. 3. Traumatology. A traumatologist specialist in trauma. 4. Pediatrics. A pediatrics specialist in primary care for children. 5. And obstetrics. An obstetrics specialist in delivering babies and caring for pregnant women. Split the table with words from A, B, and C opposite and related to them. Put a asterisk mark in front of the stressed syllable in each word. The first one has been done for you. Verb, noun, person, noun, activity, specialist, specialist, speciality, practice, practitioner, practice, consult, consultant, consulting, assist, assistant, assisted, graduate, graduated, graduating, qualify, qualified, qualified, qualified. Five prepositions in the opposite that can be used to make word combinations with the word in the box. Then use the correct forms of the word to complete the sentences. 1. A pathologist is interested in diagnosing disease through examining cells and tissue. 2. A pediatrician must enjoy working with children. 3. An oncologist is specialist in the diagnosing and treatment of cancer. 4. A psychiatrist must be good at counseling. 5. A neurosurgeon must be good with arms. Make word combinations using a word from each box. 2 words can be used twice. Look at A, B, and C opposite to help you. 1. Consulting rooms. 2. General practitioner. 3. Group practice. 4. Health center. 5. Internal medicine. 6. Surgical specialties. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. 1. Associate specialist. 2. House officer. 3. On-call. 4. Professional diagnosis. 5. Review pager. Match the description 1 to 5 with the job title A to E. Look at A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. C. Consultant. 2. Dr. Stewart has just started the second year of her foundation's program. D. SHO. Senior House Officer. 3. Dr. Sen has started his training as a Gerson A specialist registrar. 4. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. E. PRHO or House Officer. 5. Dr. Miller is in charge of the medical staff in the Birmingham Hospital. B. Medical Director. Treatment to all faults. 5 reasons for your answer in A, B, and C opposite. 1. A medical graduate becomes registered years after graduation. False. 2. The system of training doctor in Britain is called the Foundations Program. True. 3. The name Senior House Officer is no longer used in Britain. False. 4. The consultant is usually the first doctor to see new patients. True. 5. When working in shift, all doctors take turns to be on call. True. Complete the text of a PRHO describing her job like at A, B, and C opposite to her job. When I go to work, the first with I do is talk to the house officer who was on duty during the last shift to find out if there have been any noise. Then I generally see the charge nurse. He tells they if there is any that need to be done urgently, such as intravenous line to put up of take down. Later in the morning, I register any new patients with basically involves history. On Tuesday and Friday morning, the consultant does her work room and I have to make sure I'm completely up to date on the person. After that, here are usually lots of things to do, like writing a request forms for blood to be administered in the afternoon. I have the prepared for any patient who I will be going home the next day. They're usually happy to be going him home, and of course there are the lectures and and tutorials in the foundation program on Monday and Wednesday. The sentences let add A, B, and C opposite to help you. 1. Someone who specializes in delivering babies is a midwife. 2. Someone who is qualified to assist nurses is a clinical support worker. 3. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. 4. A nurse who has qualified is a staff nurse. 5. A nurse who specializes in healthcare promotion is a health visitor.